Have you ever wondered how babies go from gurgles to words in just a few years? Hi, my name is Christine Scalise, speech language pathologist and educational instructor at Granite Bay Speech. Today we are going to dive into the fascinating world of early childhood speech development. In this segment, we are going to review the traditional key milestones from birth to age 3. Let's get started. From the moment a baby is born, they are already communicating. Infants will cry to communicate needs such as hunger, discomfort, or pain. By around 2 months, you may see your little one emerge with sweet little coos. Coos is primarily comprised of single vowels such as oo and ah, but you may hear other sounds such as coo, such as the name, and goo. Following cooing comes babbling. Babbling begins around 4 months. When a baby begins to babble, they will typically start with repetitive sound combinations such as da da da, ba ba ba. By around 9 months, your baby's babbling will evolve and include different sounds. So on our right-hand side, you'll see some different combinations of consonants and vowels. So you may hear ba ba da ma, goo dee me. They're trying to imitate the language that they are hearing around them. Around their first birthday, your baby may begin saying their first word. You may hear words such as mama, dada, and bye-bye. During this magical time, your little one is soaking in the language around them and forming one-word utterances. Babies learn by imitating. Parents, you are your baby's best teacher. By talking and playing with your baby, you are building those precious speech and language skills while fostering a loving bond that will last a lifetime. A parent knows their child better than anyone in the world. Your love and attention to your baby is crucial for their speech and language development. From responding to their first cries, singing, reading books, to playing toys on the floor. These activities are important for the child to feel secure and have countless opportunities to be exposed to language. By around 18 to 24 months, the language boom happens. In this amazing milestone, you can hear your toddler say 2-word phrases like more milk and mommy eat. You will also see a huge jump in their vocabulary. When a child is around 3 years old, they will develop a more complex sentence structure of around 3 to 5-word sentences and may have a vocabulary of 1,000 words or more. Although these developmental milestones are more like guidelines, we recommend reaching out to your pediatrician or speech language pathologist if you notice the following. If by 6 months your baby is not making vocalizations, such as cooing or babbling, or by 12 months if your child is not responding to sounds, imitating simple sounds, or making attempts at simple word-like sounds by their first birthday, we strongly recommend consulting with a speech-language pathologist so we can look at your child and see how they best learn, because there are different ways to communicate and different ways to learn language. If by 18 months your child is not using gestures such as pointing or waving or producing a few recognizable words, or if by 24 months your child has limited vocabulary, which is fewer than 50 words, and is not starting to combine words into simple phrases or sentences, we strongly, again, recommend consulting with a speech-language pathologist because we are here to support you and your family. Again, these are just rough milestones. Children acquire their speech and language at different points, and again, there are so many different ways to communicate and learn. By 30 months, if a child is not making steady progress in speech or language development, including the use of a more complex sentence structure, or if you notice their vocabulary isn't growing, or by 36 months, if a child has significant difficulty being understood by others, is using a different sentence structure than their peers, or shows signs of stuttering, we strongly encourage you to again reach out to a speech-language pathologist. At Granite Bay Speech, We tailor our therapy to the child and family's specific needs because, again, every person learns differently and everyone communicates differently. We are here to support and guide your child and your family on this unique speech and language journey. So again, this is a more typical or common way that babies develop speech and language. But remember, there are different types of brains and different wirings, which means people learn differently, and there are different forms of communication. All communication is valid, whether it be sign language, gesturing, writing, using a communication device, speaking. Those are just a few of the many different ways people can communicate with those around them. By consulting a speech language pathologist, we are here to help identify the underlying causes of communication challenges and provide tailored treatment for your child and family's unique and specific needs. Thank you so much for joining us today. If you liked the video, click like and subscribe for more educational content. See you next time.